Okay, great. And again, good morning. This is Tara Harper, yours truly, coming from Tara Talk of THCOD, which is Tara's Healthcare Consulting and Office Design. And I'm doing a study segment for those who are getting their RHIA, RHIT um, studies. So wanted to enlighten you on some of the courses. Today we're going to be talking about quality and performance improvement out of the 2009 PRG, which is what I'm working on. Some of you all may have, again, 2008, 9, 10, 11, or even 12, and that's perfectly fine. Some of the questions are similar, some of them are very different. But just follow along as much as you can. If you do not have what I have, then it's okay. Please feel free to contact me. My email is T as in Tom, HCOD at hotmail.com. And my cell is 281 723 4762 is my cell phone. Thank you so very much. And let's get started. Okay, again, I have the reference book by Miranda Johns that I'm going to be referring to today. And I also have the Kathleen Latour book that I'm going to be referring from today as well. Okay? Okay, number 68. Refer to the table summary of the selected blood product review. Which blood component or derivative has the most units reviewed? Now, if you have the same number 68 that I do, and then you read through that, you'll see that there is a summary of selected blood product review to utilize for this question. Number 68, 2009 PRG. Refer to the table summary of the selected blood product review. Which blood component or derivative has the most units reviewed? Is it packed red blood cells, fresh frozen plasma, platelets, or unable to determine from the table? And let's look at the table here. On the table, it has monitoring element, which is N equals 295. And so that must be the net count. For the packed red blood cells, you have 256. For fresh frozen plasma, the net count is 29. And for platelets, the net count is 10. Indications for each one, net is 232, which is 91%, 24, which is 9%. Net N for frozen plasma is 24%. Frozen plasma unmet, which is 76%. Platelets for met N is 100%, and unmet N is 0%. So now, let's look at the question again. The question says, refer to the table summary of selected blood product review. Which blood component or derivative has the most units reviewed? Has the most units reviewed. Okay, so to get a clear understanding, let's go to our John's book, which is page 434, so we can understand how to properly pick the answer. Again, as I stated before, application to the answer will help you understand why you chose the answer. Taking these kind of exams is not a guessing game. It's about application. Okay, let's see here. It says 434 to page 438. This is not what we need here. Okay, and it's not in this book properly. So let's look at page. Let's look at page. It says in Latour 402. So let's take a peek through that. Page 402 in the Latour book, Kathleen Latour, page 402. And let's take a see. Ratios and proportions. blah, blah, blah. Okay, that's not quite what we need. Um, Page 422, let's go there right quickly. Okay, so I'm looking at page 422, and it says also to look at page 423. I'm going to give this a few more minutes for the sake of time. If I do not find the exact reasons for this answer, I will reveal the answer in a minute. But we will put a pin in this and come back to number 68 much later for the sake of time. Okay. Yeah, I don't quite see. Okay, the answer here for number 68 is A as in apple, which is red packed cells. Refer to the table of summary of selected blood product review. Which blood component or derivative has the most units reviewed? And again, it says red, packed red blood cells. Okay, so we're going to come back to this. All right, fantastic. Okay, so A is an apple is the answer. A is an apple is the answer. Packed red blood cells has uh, the blood component or derivative for the most units reviewed. Okay, number 69. Refer to the table of summary. Refer to the table summary of selected blood product review. The table was first produced during the quality improvement function. Okay, refer to the table summary of the selected blood product review, and we looked over at this. The table with the first product during which quality improvement function. Okay, the answer choices: is it pharmacy at therapeutic function? Is it drug usage evaluation? Is it medical record review or blood usage review? And of course, self-explanatory, the question here states, the answer here is choice D, which is blood usage review. It says the table was first produced during which quality improvement function? And the function used for this table was for blood usage review. Blood usage review. Okay? All right. Number 70. Refer to the table of summary for selected blood product review, which is the same table we've been using for number 68 and 69. What percent of the frozen plasma units met indications? Is it A, 7%, B, 24%, C, 22%, D, 76%? And the answer here is B as in boy, which is 24%. And if we look at the table for fresh frozen plasma units met indications, you already see here the automatic answer is 24% for the category of fresh frozen plasma, which is 24%. So this is your answer right here. Okay? Alrighty, so moving right along, we've selected 69, 70, 70, 20, 70 is B as in boy for 24%. Okay, number 71. Which of the table summary for selected blood product review, based on the results reported in the table, which blood component or derivative should first be the topic of an in-depth study? Which blood component or derivative should first be the topic of an in-depth study? Okay. Choices are packed red blood cells, fresh frozen plasma, platelets, or unable to determine from the table. Okay. Uh, and we should say B as in boy, which is fresh frozen plasma. Fresh frozen plasma. That should be the answer. Okay. All right. Give me just a minute. I need to take my medicine. Give me just 1 minute. Trying to lose weight here, so I'm getting a little personal on camera, okay? Okay. Ew. Okay. Alrighty, coming back here. Okay, let's read number 71. Number 71 has a case study to it. And I'm also going to share some test taking techniques. If you're a person that's a little challenged with sitting for very long periods of time, taking a 4.5 hour, 4 hour exam, it could be quite challenging to sit and focus, especially in a cold room and you're trying to think, or even in a hot room and yet you're still trying to think. So I'm going to give you some test taking tips once I finish this segment. Okay, case study number 1, which is number 72. Upon employment at your facility, all new employees read, demonstrate understanding, and sign confidentiality statements. Disclosure of the confidential information are grounds for immediate dismissal. Each year during the annual performance evaluation, every employee again reads, demonstrates understanding, and signs the confidentiality statement. You are the director of quality improvement. Your department has found the femoral popliteal bypass failure rate of one of your vascular surgeons, Dr. Z, is twice that of the national average. Members of the surgery department have reviewed that vascular surgeon's performance both by reading the medical records and by watching videos of her surgery. The surgery department and the executive committee have decided to deny reappointment for this particular surgeon. Lucille X, the mother of one of your quality coordinators, has severe peripheral vascular disease. She was admitted to your facility and had an angiogram. The angiogram showed that she should have had a femoral popliteal bypass. She had told you that she would be in your facility and asked you to visit her. You are now fulfilling the promise and also bringing her flowers. While pursuing to knock on her door, you hear your employee Mary G vehemently state to her, "Mom, Dr. Z is a quack. Half of her bypass surgeries fail. You must have Dr. Dogood." Okay, so we just read the scenario here. Let's see what happens for quality and performance improvement. Okay, Referring to the case study number 1, what do you do as director of quality of the quality department? Do you A, seek the advice of the facility's legal counsel? Do you B, immediately dismiss Mary G upon her arrival back in the department? C, do you walk into Lucille's room and state that Dr. Z is a fine surgeon and also advise Mary to lower her voice? Or D, upon Mary G's arrival back to the department, give her a written warning? What should you do as as the director of the quality um, department, and you walk in and you overhear someone saying something, which is an employee telling their mom that Dr. Z is a quack, okay? And this is vermittently someone that works at the hospital with you, okay? All right. So the answer choices were read. B, as in boy, is the answer choice. Immediately dismissed Mary G upon her arrival back into the department. Okay, so let's look in the Kathleen Latour book. It says here, page 265, and let's get an understanding uh, why uh, the employee, which is the mother of the patient, should be dismissed for saying such a thing of Dr. Z. Okay, okay. Here's one part right here where it says other liability issues for confidentiality of quality improvement and concurrent review activities. Hospitals and other healthcare providers face other liability issues. Hospital staff members must have a duty to advise appropriate member of administration when they become aware of any action or failure to act that is below the standard of care. The standard of care does not apply to direct patient care. By definition, it applies to safeguarding a person's personal belongings, whether they are placed in direct care or not. For patient and staff personal belongings, okay, this talks about personal belongings, but this doesn't talk necessary in regards to, um, okay, it doesn't quickly explain it. However, on an ethics standpoint, um, you don't want to talk um, bad about a staff member or even a physician and give a formal opinion as an employee, not on hospital grounds. And even though that is your parent and you're trying to protect your parent, you don't want to give bad advice on hospital grounds. Not like that. If you're going to have something private to say about a person, and I'm not justifying what the case scenario is stating is right. I'm not saying that at all. But this is in case this case scenario. This is this young lady's mom. When you want to say something, you should lock the door, and that should be a privy information between you and the patient, which is the mom. The mom is uh, the patient of the hospital, so that setting remains legal in that setting because it's no longer looked upon just as your mom, and you have every right to say what you want to say, or a relative, or aunt, or whomever. You still, as an employee, as a professional employee, have to respect another person's professional standard. And so just be mindful as professionals that cases like this can occur where someone can walk in and overhear you, and then you're snatched. Your job is gone, done for, period, the end. Okay, so be careful of that. So that's just looking at answer choices here. It's just the automatic known fact that that should not have been said. And yes, she is immediately dismissed upon her arrival back to the department. And I'm sure reprimands in that instance is not very nice. Okay, number 73. Referring to case study number 1 are meeting minutes about the decisions referring to Dr. Z of the Department of Surgery and of the Executive Committee admissible in court. Should you say yes, federal amendments to the Medicare Act require release of peer review? Should you say yes, number B, which state laws allow discovery of medical review committee records? Should you say C, which is no, the Federal Freedom of Information Act and state sunshine laws protect peer review? Or should you say no, under the state law, records of medical review committees are not subject to introduction into evidence? The answer here for number 73, is D as in David, which is no. Under the state laws, record of medical review committees are not subject to introduction into evidence. Okay, so that takes care of number 73. Moving on to number 74, case study number 2. It says here, you are helping the nursing department to write indicators to determine appropriate formulas for ratios and to determine data collection timeframes. One important aspect of care is the documentation of education of patients. More specifically, the nursing department would like to assess its documentation of education on colostomy care for patients with new colostomies. Number 74. Referring to case study number 2, what would be the most effective and appropriate data collection time frame? Would it be prospectively, concurrently, retrospectively, or long-term care review? Which choice would it be? What would be the most cost-effective and appropriate data collection time frame? Would it be retrospectively, long-term care review, prospectively, or concurrently? And the answer choice here is C as in cat, which is retrospectively. Retrospectively. Okay, number 75. Referring to case study number 2, which of the following ratios would you recommend? The number of A, the number of records with documentation of colostomy care teaching over the number of patients in the surgery unit. Would you consider B, number of records with documentation of teaching over the number of discharges? Would you consider C, the number of records of documentation of colostomy care teaching over the number of patients with new colostomy? Or D, the number of records reviewed with documentation of colostomy care teaching over the number of records reviewed? The answer here is C as in cat, which is the numbers of documentation of colostomy care teaching over the number of patients with new colostomy. So let's dissect number 75 for a minute. The nursing department, you are helping the nursing department to write indicators to determine appropriate formulas for ratios, to determine data collection of timeframes. One important aspect of care is the documentation of education of patients. The education of patients, that's a variable to look at. More specifically, the nursing department would like to assess its documentation of education on colostomy care for patients with new colostomies. So you have two indicators here. You have one important aspect of care is the documentation of education of patients concerning their colostomies, and the nursing department would like to assess documentation of education on colostomy care for patients with new colostomies. You have new colostomies versus regular patients of who've been educated. Okay, so the formula here to give the nurses when you help them figure out a ratio is the number of records with documentation of colostomy care teaching over the number of patients with new colostomies. So this would tell the nurses how many, what is the ratio of new colostomies versus those that have colostomies, but yet both seems like in this situation both have been educated, but one is just newer over the other. Okay, so this is very good. Okay, number 76, and we're still taping off on YouTube. So again, I'm still trying to see how far I can go. We're 26 minutes into the segment. So I'm trying to see how long this will let me go. And forget about the shirt here because that's no longer relevant in my life. Although it was a very good company to work for, but it's no longer relevant in my life. Okay. End of story. Number 76. A culture and sensitivity report was returned to the inpatient unit of Bryan Hospital. The sensitivity showed bacterial resistance to the concurrent antibiotic the patient was receiving. The patient continued on the same antibiotic without improvement. A genetic quality screen identified this case for review. At minimum, which committee should review this case? A culture and sensitivity. Hold on, give me something to drink. Okay. A culture and sensitivity report was returned to the inpatient unit of Bryan Hospital. The sensitivity showed bacterial resistance to the concurrent antibiotic the patient was receiving. The patient continued on the same antibiotic without improvement. Okay. A generic quality screen identified the case for review. At a minimum, which committee should review this case? Should it be the surgical case review? Should it be the safety committee, the information management committee, or the pharmacy and therapeutics committee? I think this is pretty self-explanatory because this is antibiotics and it's talking about the patient and how it's either helping them or not helping them. And obviously, from this standpoint, it should be the Pharmacy and Therapeutics Committee, which is D as in David. The answer choice is D as in David. And they're particularly talking about antibiotics, which is medicine. And therefore, that data of information belongs to the Pharmacy and Therapeutic Committee for number 76. Okay, number 77. The outpatient, and we're going to make this the last one because this is going on 28 point some minutes. Okay, the occupation coding staff has been working on to improve the coding accuracy. The standard for the number of cases that must be coded has been raised 4 times in the past year. The staff states that the more cases that must be coded, the greater error rate would be for a corresponding time period. The department keeps statistics on both the number of cases coded and the corresponding error rate. What is the best quality improvement tool for testing the coding staff's theory? Should it be a control chart, Pareto chart, run chart, or scattered diagram? The answer choice is D as in David, which is a scattered diagram. Okay, so we're going to stop right here for a moment on number 77 of the 2009 PRG, and I'm going to start the YouTube recording over, and we'll be right back.